Welcome to Yaarah's Yard podcast. Topics will include Vermont, head injury, PTSD, veterans, disability issues, homelessness, and more. It's created by me, Emily Cindy Wood, a native Vermonter, survivor of encephalitis and coma, survivor of domestic violence, as well as cancer survivor. Looking forward to being with you.
Hello, I'm back again, and I'm just going to talk about a different topic completely with this upload. This is the second upload here of me speaking. The first one was about growing up in Vermont, and specifically Rutland City in Vermont. That's where I grew up. My vocal quality was different in that upload than what it's going to be in this one, because I had a throat infection that I didn't know about when I was doing that recording. I also had slightly swollen vocal cords, and I was going through chemotherapy. So that kind of gives a hint about what the topic is going to be in this upload here. In September 2018, I discovered a hard mass underneath my left breast, on the bottom side of it, and some of the skin around and on my nipple was puckered. It was dimpled like a skin of an orange, pretty much. And I ended up discovering that because I leaned against the dining table and ended up in terrible pain simply from leaning against the table to reach for something. So my primary doctor set me up with a mammogram, which found 2 abnormal masses in the left breast. Then I went on to an ultrasound. This is all happening in September 2018. Presently, it is October 22nd, 2019. So I went to an ultrasound that found verification of 2 masses in the breast. The next step was a core biopsy, still in September 2018. So the core biopsy revealed ductal invasive breast cancer that's metastatic. They didn't know how extensive the cancer was yet, but they were able to determine that it was fed by estrogen. It's referred to as estrogen receptive, and I had not gone through menopause yet. Basically, October 17th, 2018, a little over a year ago, I went into surgery and my entire left breast was removed, along with 6 lymph nodes under the arm on the left side. Half of the lymph nodes were found to be cancerous. Some lymph nodes that appeared to be cancerous under my arm were not able to be removed, and they were stuck like glue. The removed breast was dissected. It was cut into 8 parts. 7 of the 8 parts were completely full of cancer. The cancer was in the arteries, it was in the skin, it was everywhere, which really freaked me out. because if the cancer is in the skin, where else is it? If it's in the skin in my breast, where else did it go? If it's in the arteries, it must be throughout my entire body. What's going on? So I got help from my children and people from the synagogue that I attend. The synagogue set up something called a meal train, which means they brought prepared food that I wouldn't have to cook for 2 weeks after the mastectomy. My children came and helped with bringing out the trash, doing laundry, washing dishes, and other things. I had a couple of drains. The tubes, unbeknownst to me, were grossly underneath my skin, going down the length of my torso, which was part of the problem I was having with being mobile and moving around. All I was able to do was lay down, sit, and make it to the bathroom. And it was painful getting to the bathroom because simply to lift my arm up off the pillow in order to move was terrible. It hurt like hell. The incision from the mastectomy is 7 inches long. I have measured it, believe me. And during that time that I was recovering at first from the mastectomy, I was set up with visiting nurses. They would come to check my vitals, my blood pressure and my pulse and things. And they would check the mastectomy site. A week after the mastectomy, the drains were taken out, which did not feel good having them taken out, but helped a hell of a lot as far as being able to move again and being more comfortable. One very strange fact is that after the mastectomy, I began sleeping on my right side, laying on my right side with my left arm, laying on a folded pillow. And to this very day, that is how I go to sleep. And it is over a year later. I tried numerous times during the recovery period here to sleep without the folded pillow, and I can't sleep without it now, but I still have to go to sleep with my arm on the pillow. And that's something that maybe will change in the future, but I don't know. So I had the mastectomy October 17th, 2018. December 20th was when chemotherapy began. And I didn't start losing my hair until between the second and third treatment. There were 8 treatments total. They were each separated by 3 weeks. So every 3 weeks I would have a treatment, and it would take a few hours to get the treatment. I'd have to go in, get my blood tested, and it would be sitting there waiting for quite a while for one certain drug, then another certain drug. And it wasn't simply, okay, they're just giving you an infusion of only the chemotherapy drugs. They first would hydrate me. Then they would, through the infusions, they would give me medication that would help with nausea. Then they would give me 2 different types of chemotherapy drugs, probably one and then the next, whatever. They would give me a shot sometimes. So I didn't always have to have the shot. The shot had to do with building up the blood if my blood was low. And there was an injection that had to go into my chemo port, but they would have to manually administer it through with this giant, my brain can't think of the word, this giant needle thing. Anyways, that's called word finding for anyone that doesn't know. So like I said, my hair started falling out between the second and the third treatment. I got my hair cut from being down to my waist. It was cut to a little above my shoulders the day that I was told by the surgeon that was going to do the mastectomy, that I would probably have to have chemo. So that was more upsetting to me than the fact that I had cancer, the fact that I was going to lose my hair. I didn't cry about having cancer. I cried about losing my hair because it took me a long time to grow it out that long. Part of my ethnic ancestry includes Native American, and I was trying to keep it long and stuff because it was a connection to my roots. It was trying to connect with the Native American part of me that is still there. So yeah, I cried about the hair being cut, but the person that was cutting the hair took my hair and donated it to a children's foundation, and that made me feel better. I wasn't used to having short hair. I can't tell you when the last time was that I actually had my hair above my shoulders. I can't remember, to be honest. So in October 2nd, 2018 was when I got that cancer haircut. Eventually, my hair was simply falling out if I touched it. And that was upsetting as well. It was nerve-wracking, actually. It made a mess. And listen, like just running your hand over your hair lightly, or your fingers through it, the way you might do normally, was something that would make an entire mass of hair to come out, and it would be on my pillow and various things. So I read somewhere that using a silk pillowcase helps the hair not be traumatized as much, not fall out as much. Eventually it all ended up coming out anyways. But halfway through the 8 treatments of chemotherapy, the chemotherapy, pardon me, the chemotherapy medication had to be changed because there was a limit to the first kind of medication that they were giving me. it was only able to be administered a certain amount. Past that would be detrimental and harmful to the heart. So they switched from the first two types to something called Taxotere. Taxotere was given to me for the last 4 treatments. Strangely, between the 4th and the 5th treatment, my hair started growing back. And it didn't grow back normal, it grew back really sparse. The top of it grew back faster. So the side was shorter, the top was longer and sticking up. It looked like I had some makeshift, partly balding rock hairdo. And I mean, it was a little funny, but very not funny. And gradually my hair has kept on growing. I began taking hair and nails dietary supplements just to try to make sure that when my hair was growing back, it would be healthy. And I've watched videos online of people trying to show their hair growth between the end of chemo and maybe a year later or whatever. I might be imagining it, but it seems like my hair is thicker, possibly, than a lot of those people. And it might be longer already, because presently, the chemotherapy ended in the middle of May. So that goes May, June, July, August, September, October. I'm at 5 months right now. And I might be imagining it, but it looks like my hair is longer and thicker than a lot of the pictures I've seen of other people who were trying to grow back their hair after chemotherapy. And some of these people had less hair or about the same amount of hair as me a year later. And so I'm thinking maybe I must be taking some really good dietary supplements. The more recent dietary supplements for the hair that I have been taking for a little over a month is something that has bamboo extract in it. And at first I thought, what is bamboo extract doing in this? Because I didn't see it at first when I got the bottle. And when I did some research, I found out some very positive information about it. So I don't want to talk for like 3 hours. I'm actually supposed to be getting up for a very important medical appointment tomorrow, but my medical ride company, through my insurance, they have a robot call that comes the day or the night before an appointment, and it tells you when you're going to be picked up from your house to go and when you're going to be scheduled to get your ride home from the place you're going to be at. And all I got from the voicemail that it left was that I'm going to get a ride home at 2 p.m. I have no idea when I'm being picked up. And the medical appointment tomorrow is at 1 o'clock with a dermatologist about 90 minutes away. But I can't assume that I'm the only person being picked up, because it's always possible that with it being that amount of distance especially, it's always possible that the ride has to pick up someone else, then pick up me, or pick up me, then pick up somebody else on the way. If more than one person is going in that direction. So now I'm nerve-wracked, and that's why I'm awake and talking. Because I don't know when I have to be picked up, but I have to be awake for the phone call that's going to tell me. And I am not a morning person. I wasn't a great morning person before the cancer. Now I'm really not a morning person. So the end of the chemotherapy was in the middle of May. Then they waited a while, gave me a break, and radiation treatment was given to the mastectomy site in June and July of 2019. There were many side effects from all these different treatments, and it depends on the person. I have great news that I never vomited even once during chemotherapy. Never did. I honestly think that's because there were a lot of people praying for me. They were praying for me to have, an easier, healthier journey of it. It was fantastic working with the medical team. It still is. All of the people in my medical team are really nice people. They've all been respectful, empathetic, extremely helpful, and everyone in the different offices of my medical team are all trying to be on the same page, share information, collaborate with each other. A fantastic side thing of having cancer was that I got to experience acupuncture. My medical insurance never would pay for it, I'm very sure. But ironically, I have cancer. So as a cancer patient, I'm able to get acupuncture through the local cancer center. And the first time that I had treatment, I was breathing very shallow, not able to breathe deep at all, or not even really normal. And before the 20 minutes was up, I was already breathing deeply. I felt like I was breathing normal. But my breathing, even though the acupuncture has been helping my breathing and a lot of other symptoms and ailments I have, I am someone who's also asthmatic, even before the cancer. And going through the radiation treatment, they want you to breathe in deep and hold your breath. What it does is it helps to keep different organs in your body from overlapping so that the radiation is getting only to the directed, intended target instead of traveling through other things. But I wasn't able to breathe in deep enough, and I wasn't able to hold my breath long enough. And they kept on having to redo images, and it was taking longer for me. So they decided to just plain let me breathe regular, which was fine because we got through the treatments and everything. The treatments ended in the middle of July, well, around July 19th. And it's October 22nd right now. So July, August, September, October, July, August, September, October. That means 3 months. And I've had residual symptoms and side effects. from the chemotherapy and the radiation. One of those things involves neuropathy in my feet, and it limits how long I can walk or stand, which is frustrating, limiting, aggravating. And even though I live downtown in the city I live in, and I'm walking distance to the bank, the post office, various stores, a lot of different offices I might have appointments at, I'm able to possibly walk to the bank and the post office and around a bit in one store. If I go to a second store after that, I might end up biting off more than I can chew. And the neuropathy in my feet starts acting up the more that I'm on my feet. So it's like this circular thing. Well, I'll be in better health if I walk more, but I can't walk more. I can't walk more because it hurts too much. I'm taking gabapentin for the nerve pain. Originally, it was 300 milligrams, and the pain was still going on, so it was increased to 600. Now it's 900. And I'm not upset about that. I'm upset about the fact that some of the neuropathy is still going on, and I'm still limited in how much I can stand and walk. I also have very weak legs right now, and I'm in physical therapy for my legs. I went through physical therapy for the left arm on the mastectomy side. I've increased a lot of my range of motion. A lot of it is normal. There's still pulling and stretching in the mastectomy site. And the internal and external rotation of my arm does not work properly. Certain angles also work kind of funny with the arm, but it looks very normal to people that don't know that I have cancer. I was also attending a college class when I got diagnosed with cancer, and the week after the mastectomy was the midterm exam week, and I wasn't able to continue. Unable to sit up at the laptop and type. Also unable to maneuver the college textbook because it was so heavy. I ended up medically withdrawing from the class, and that was something else that made me cry. It's crazy. I didn't cry about having cancer. I cried because I was gonna have to cut my hair and then lose my hair. Next thing I cried about was having to leave the class, because this was the last class that was going to be required for me to get a bachelor's degree in professional studies from Northern Vermont University. I have been working off and on, 1 or 2 classes at a time, trying to get a bachelor's degree ever since I was in my early 20s. First, I got a degree in liberal arts from the community college, liberal arts degree. And that was an associate degree from a 2-year college. Then, little by little, I was trying to work towards the bachelor's, but things got really interrupted because I was in a violent marriage and ended up getting head trauma from physical violence. That led to seizures that I had for many years, but it also led to other issues. I was 3 years old when I had equine encephalitis and I was in a coma. When I came out of the coma, I did not recognize my mother, and I could not walk or talk, so I had to learn to walk and talk again. I don't remember that procedure. But while I was growing up, my maternal grandmother was living with me, my mother, and my two sisters. She told me that God made a liar out of those doctors. The doctor that was treating me when I had encephalitis, and I was 3, told my family that I would never walk or talk again. And so my grandmother, who we all called Gram, she used to laugh and say, "You could talk a tin ear off a Mack truck. Those doctors didn't know anything." Of course, there were a lot of people praying for me then. Just like there were a lot of people praying for me when I was going through chemotherapy and I didn't end up vomiting even once. So, no matter who you are, I believe that prayer is powerful. I don't think it matters whether you're Jewish or Christian or what you are. Prayer is powerful. Having faith is powerful. If I did not have faith, then I would not see a purpose in anything. And everything has purpose. There were a number of times when I ended up with head trauma before the cancer. Encephalitis was considered the first head injury or head trauma. And it left me with issues like getting tired before everyone else, trouble with my sense of smell, I was told also that my sense of taste was affected, but I have no idea. I like my taste in clothes. Dry humor, people. So, even though the violent husband knew that I had head trauma from being a child and had issues from that, that person still decided that it was okay to beat me in the head. He was taller than me, right-handed, and so he would hit me in the left side of the head. I've had something called neuropsychological evaluation more than once, and it pretty much reveals left hemisphere brain damage. Now we wonder what that's from, don't we? That is only one of the things proving that the head trauma happened to me. The same person also caved in my ribs, so that's more proof. I ended up with my emotional makeup, how my inflection is in my voice, facial expressions when I'm talking or doing anything, my memory, ability to learn, academics, period. All of it was changed by this person beating me in the head. And before that, I used to get A's and B's in college and in high school in most things that were not math related. Afterwards, I've had to really work hard in order to get anywhere near good grades. It was a struggle. I was also academically barred from 2 colleges because I couldn't get my grade point average over a basic C 2.0. The last 2 college classes that I took, I can proudly say that I got an A in both of them, each of them. And I got my grade point average over a 3.0. Now it's somewhere over a 3.0. And I'm happy about that. But back to the topic of this upload, I was extremely upset when I had to medically withdraw from that one college class that I was struggling through when I was diagnosed with cancer and had the mastectomy. If I was given an extension or a longer amount of time to do things, then I might have passed it. It was a hard class already without dealing with cancer or a mastectomy or any of that. It was anatomy and physiology. And one of the issues I was having was focus. I wasn't going to be able to focus. And the chemotherapy didn't start until December. That didn't matter. I couldn't focus after the mastectomy. I did what I could and did my best before that in the class. So I have to return to college. I've been doing external degree program online classes through Northern Vermont University. And the one class that's required, the only one left before I get that bachelor's degree, is a science with a lab. Presently, I'm pretty concerned about that because I was already struggling with that anatomy and physiology class. Now, I don't just have only the traumatic brain injury issues that I had prior to the mastectomy. Now, I have chemo brain. You should look that up. Now I have chemo brain. Some things that were normal and things I could kind of strategize around and work through because I was accustomed to the traumatic brain injury issues and how to work around them. That's out the window because chemo brain, that's a totally new thing for me to deal with. And I'm still trying to figure it out. When I go to my medical appointments, once in a while, I complain about my energy level. And the neuropathy is a complaint, but my energy level is another thing. And what I'm being told is it takes at least 6 months after the radiation treatment ends in order for you to start getting some of your energy or mojo back. And today is 3 months after the radiation treatment ended. So I'm only halfway through that. It's hard to be patient. Terribly hard. And I used to actually imagine cancer or assume cancer was only abnormal cells that would get killed by chemotherapy and go away. Once chemotherapy was over with, then the person's okay, right? Everything's fine. That is totally not the case. If you know anyone who's going through cancer treatment, do some research, get informed. If you want to be any kind of a support person or part of their positive network, you need to understand just because their chemotherapy is over with, it does not mean that they are out of the woods. It doesn't mean they're normal again. It doesn't mean their life is normal again. Cancer has ruined everything for me. I mean, it took me out of my college class, robbed me of my bachelor's degree, okay? It took my hair. It made me have to practice vocal rest because I ended up with a throat infection. I'm talking about, I live alone. You have to look at all of the different factors here. I live alone. I don't have somebody to get on the phone and make phone calls for me. I have to do it. So I spent a good part of my chemotherapy treatment practicing complete vocal rest when I was home alone, unless I absolutely needed to speak. Try that on for a while. Put yourself in those shoes. That's only one aspect of it. My budget, just like the budget of many other people who end up with cancer, totally out the window. Everything changed because I not only have to pay out of my pocket for visiting nurse agency to send me people a couple times a week to clean in my apartment just to make sure I have that asset in the future. I also have to eat a totally different way than what I was used to eating before. I've had to change my diet, my wardrobe, my budget, how I organize my apartment. I have clothes that I can't fit into now after all of this adenomyosis and cancer. And they're all hanging, for the most part, they're hanging in my walk-in closet. I gave some of my small clothes to my daughter, and other small clothes I donated to the rummage sale at the synagogue that I attend. But I'm still going to need more clothes. The way that I used to dress and be able to layer and other things for cold weather, I'm not able to do that now because, well, heck. For one thing, when I go in a store, I can't go to the same section to shop. And so many other women probably have this deal too. But, I gained weight. I was 137 pounds in a size small to medium when I did not have adenomyosis. After adenomyosis, I ended up gaining weight. I ended up like 150 pounds, 160. When I was going through chemotherapy, I ended up 204 pounds. I've lost a lot of weight though. And I think, if I'm correct, I might have gotten down to 184 pounds. But we all know, because I told you about my neuropathy in my feet, that it's not because I'm walking a lot. Just remember that simply because chemotherapy is over with, simply because someone had a surgery to remove cancer, simply because they had radiation, it doesn't mean that suddenly they're okay because the treatment is over. That's not the case. There are residual symptoms from those treatments. There are residual things in that person's life that is going to make that person's life not the same ever again. So I can repeat myself, but just get educated, do research, find out about the stage of cancer and the type of cancer that someone you care about actually has. I have had some people say, oh, you're fine now, right? They removed all the cancer, right? No, they didn't remove the cancer because there was still cancer in me. Simply because they removed my breast doesn't mean that they got it all, because there were cancerous lymph nodes under my arm that they couldn't remove that were stuck like glue. And that means that the cancer was in my lymphatic system. I also have the BRCA2 cancer gene, and that puts me at a risk of cancer in the other breast. It puts me at a risk of uterine cancer, ovarian cancer, pancreatic cancer, skin cancer. So my journey is just beginning, okay? I'm on something called tamoxifen. It's a medication to block estrogen in the body. But no, I haven't grown a beard yet. I'll let you know if I do. I don't plan on it, though. If I do, it will be an accident. Totally. So that's one thing that's being done to starve any cancer that might be trying to grow in my body. And another step that's being taken to reduce the estrogen, and reduce the cancer risk is November 12th, 2019. I will be going into surgery to have my ovaries and fallopian tubes removed. That will decrease the estrogen in my body as well, because the cancer feeds off the estrogen. If there's no estrogen or it's decreased, then it will start the cancer. So I don't know the timeline after that of everything, but at some point I will be going for another mastectomy, and the right breast, the entire right breast, will be removed, and a bilateral reconstruction of the chest will happen at the same, immediately afterwards. So one thing that's positive about that is maybe my clothes will hang better. I have a lymphedema sleeve. Lymphedema is swelling that can happen as a result of surgery or injury, and I was told I'm at risk of it for the rest of my life. There are certain things I have to do in order to keep the lymph flow going in my body, on the left arm and the mastectomy site. There's a sleeve that I can wear that compresses the left arm, and it helps to prevent the swelling, or control it, I guess, if I end up with it swelled. And I have the chemo port still in. I decided to keep it because it would be so much more convenient to get blood work done through the chemo port instead of getting a needle in my arm, which I don't really like the needle in my arm. The numbing cream for the chemo port is interesting because, well, sometimes I use it and it works. Other times it doesn't work, but they have a shot that they can give you, and it feels like a sting from a bee or whatever. It just gives you a stinging sensation really quick, and it numbs you in the chemo port area, and then you don't feel it when the needle goes in. It hurts a lot less to get the shot for the numbing than it does to feel the needle going in if it's not numb enough. So just a tip right there. And keeping hydrated is a major issue. When I was going through chemotherapy, I would be extremely sick if I didn't drink enough. I was timing myself like every couple of hours trying to start another glass or cup of drink. And now that the chemotherapy and the radiation is over with, I literally am being a total lame ass when it comes to being hydrated, because I just don't think of it. And I'm distracted a lot, not very focused. Although I have been binge watching Netflix, and heck, I watched every single episode of Winona Earp, and I watched what's it called, Arthur Chronicles. I watched Arrow. I've been watching a lot of Chinese and Oriental shows and movies. But anyways, I've just watched so much Netflix. But what's terrible is, even though I don't remember enough when I'm trying to think of something to tell you. Unless you were going to sit here and let me scroll, I loved the show Outlander, waiting for the next season. I watched all of the Iron Fist, the Beauty and the Beast, on and on. Anyways, the point I'm trying to make, mainly by talking like this in this upload, is cancer is not what you expect. It's not what you assume. It is what it is. And if you are diagnosed with it, if it runs in your family, if you have people in your life that are dealing with it, getting educated is the best armor that you can have, because it's not very nice for the person going through it when other people act like all of a sudden you're okay because one part of the step in treatment is over with. It just doesn't suddenly become okay. And there are some things that are often told to people that have cancer that are extremely inappropriate. And most of those things seem like they are kind, empathetic things to say. Just one example is, I hope you get better soon. I'm in remission right now, but get better soon? The only time that I'm not going to have to worry about cancer is when I'm dead, okay? So how nice is that to say to me? Talking to the person like they did something to ask for it. Oh, maybe if you ate better. Were you smoking a lot? Or, well, you look fantastic. Personally, I'm offended when someone says that my hair looks great the way it is, because the way my hair is right now is a reminder. It's a total reminder that I've had chemotherapy and that I have to deal with cancer for the rest of my life. This is not me. This isn't the hair I chose. It's not a hairdo that I wanted. But a lot of people have complimented me and said, oh, you look great. You don't have to cover it up. That looks great. Or bald is beautiful. Why are you going to tell someone bald is beautiful when the reason they're bald is they could die? Why? Being positive is helpful, but telling someone you need to just be positive is also not very thoughtful. I think people that are going through cancer need to be allowed to go through their own grieving period because they've lost the pre-cancer self that they used to be or used to have, the pre-cancer life, the way that they used to feel about themselves, the way they felt wearing their clothes. All of that is gone. And it's just not very thoughtful to say things like, bald is beautiful. Just be positive. It doesn't work for me. Another thing that doesn't help is telling people who have cancer about someone else that you know who died of cancer. Well, thanks for the reminder that I might die too. Oh, that's a really happy ending. Thanks a lot. The biggest thing that I've learned about having cancer is it's a lifelong journey. A friend of mine was an inspiration, very positive, upbeat, everything, and was so happy that they were almost to their 5-year mark of no cancer after going through cancer treatment themselves. For a while, I didn't see them around. I assumed, well, they must be busy. Something must be going on. I had no idea. Cancer had come back. That person ended up with the cancer coming back, but it was in a different part of their body, which is really scary. And I want to point out one thing, and it's the biggest point that I want to make. Faith and hope. Forget I just think positive. Faith and hope. Purpose. Those are things each of us needs to understand, focus on, and believe in. Whether you have cancer or not, whether you are going through domestic violence or not, maybe you're dealing with something else in life, maybe you have some type of disability, financial problems, problems at work. There is a way to get through it, no matter what. Don't forget it. Well, it's time to go now. And thank you for joining me on Yaarah's Yard podcast. For now, goodbye.